So when I started at the Louisville Urban League in 2015, I was brought in to write a grant around health. And usually what you find is there's an absence of resources and things for community members who are in need to really get hold of. But that really wasn't the case here. There's an abundance of resources in the city, but a lot of people were having difficulty accessing them, and more importantly, were having difficulty staying engaged because the process to access those health resources was hard and was tedious. It's complicated, and people were just bogged down with kind of personal issues, traumas, things that they were managing, and it was very difficult to get through. And so that's what we built with our community health worker program. It was a program where our community health workers really dealt with all of the different issues, whether that be housing insecurity, child care, food instability, all sorts of things, including your physical and mental health. But how do you navigate somebody to the resources that are out there, whether we have them here in the building or out in the community? How do you navigate them to those resources? But then more importantly, how do you stay with them through the process? How do you make sure that they complete the form, that they actually go to the appointment, that they follow up on the medicine or go back for the follow-up appointment, do the things that are necessary that are going to actually move the needle on their health. So our clients who come through the doors are getting re-engaged in that way. They are really thinking about intentionally about how they, seek out the help and the support that they need, the resources that they need for them and their families. And for the first time, for some of them, they're really, committed to going through the process, and that's because they have the help. They have the understanding, somebody who's there to explain things to them, to advocate for them if necessary, and to walk through the process with them as well.
So we're going to get her with housing so that they can try and advise her on
what community health workers bring is a trusted perspective. That is really where they are essential, is that they provide trust to a medical system that, quite frankly, doesn't always have the trust of the public. And for a good reason, right? Like, lots of people have been hurt and harmed by the medical industry over the years, both intentionally as well as unintentionally. And so that means that there are a lot of people who are not seeking out help and support, and not going to their doctors, not taking their medicine, not engaging in their own health and well-being. But community health workers are a great bridge to be able to do that. And so they provide an essential service for all communities. And so we need to treat them as the critical and vital part of the ecosystem that they are.